New guidelines could change how early high cholesterol is detected and how doctors prevent heart disease.
This is how it starts, and you start having this accumulate as young as 19. So
That's Dr. Thomas Alexander at Corpus Christi Medical Center, pointing out how too much bad cholesterol could block arteries. He says new recommendations issued by the American Heart Association could help spot warning signs sooner.
It has changed the way we think. We want to treat people earlier. Prevention is always better than curing, so that's what we recognize. The guidelines want to recognize people at risk of it and prevent things like heart attacks, strokes, and even death.
Dr. Alexander says checks could start in patients as young as 9 years old, and other changes focus on medication.
Increase the number of people who should be on statins, which are cholesterol medications. Every diabetic, I'm a type 2 diabetic, I'm on a statin.
Melissa Castro,
I was 37 years old when I had a heart attack.
Is a survivor. She has a family history of diabetes and heart disease, which played a big role when she was diagnosed with type 2 diabetes at just 18.
My mom's dad was diabetic. I saw him go through the loss of eyesight. I saw him go through amputations.
Castro says she saw a specialist right after her diagnosis, learning to prioritize her health from a young age. A key lesson that helped her when she had a heart attack nearly 20 years later in an emergency room.
My story went so much different because I was in the best place I could have been. So my heart really didn't have a lot of damage.
Castro's genetic risk made her case unique, but the lesson applies to everyone.
Being in tune with your body is going to make such a difference. And you've got to accept it and know that you are in charge of the quality of life that you want to have.
Now, doctors say these warning signs can show up in anyone. Dr. Alexander says that in South Texas, we have an increased population with high blood pressure, obesity, and diabetes compared to the rest of the state. He tells me it's never too early to take preventative measures for your heart health and calculate your risk of heart disease. Mike.